One of the big topics nationally has been health care, and it's something that our next guest is attempting to tackle down in Austin during the 85th Texas Legislative Session. Joining us on the phones right now, State Representative Dustin Burrows, State Rep for District 83. Representative Burrows, welcome back to the show.
Chad, I really appreciate you having me on this morning.
Absolutely. We had a listener on yesterday, and I've received a couple of emails about this, and it is, if we're going to fix healthcare, one of the things people would like to see is how much it's going to cost. You know, some of these medical services, they don't know how much it costs when they go in and see a doctor, and when a doctor brings up something, no one knows exactly how much it's going to be. There's not a fixed price associated with it. You have a bill, HB 307, that would actually address this, correct?
Yes, absolutely, Chad. I could not agree more. I mean, the key to the problem is the underlying healthcare costs that continue to rise. We can get into some of the numbers and the pain that everybody's feeling because of it. But, you know, I think the Texas solution and the model that I propose is let's start with healthcare price transparency. There's some a bill, HB 307, I filed back in November. If people have been following me, I've been working on this for 2 years. And then incentivizing people to actually shop around and negotiate better prices and getting consumerism and market forces back into healthcare costs. And I think this is the key to success in bringing down costs of healthcare and health insurance to something that's reasonable and affordable.
For those who say, well, you can always ask your provider or the doctor, you can always ask before the procedure, do we really need this? What's your answer to that?
Yeah, you can always ask, but you're not going to actually get most of the time a real answer. I mean, I hear story after story of people who go in for health care and they're told what their deductible or what their copay is, but they're never told what the overall cost is. And a lot of times the provider says, well, I really don't know at this point in time until I actually go and bill it. We can fix that. Back in 2007, Senator Duncan and Representative Carl Isett took the lead on this issue. I think Lubbock's been leading in the state on this for a long time. And the current law is if you make a written request within 10 days, you have to get an estimate from your provider for what something costs. We can speed that up immensely, and we can start putting things back into place for shoppable events. I mean, obviously, emergency situations, this wouldn't apply. In complicated cancer treatments, this can't apply because it's impossible to estimate, at limited amount of time or big procedures what it is. But there's a majority of things that people consume on a daily basis that we can post online. And other facilities do that. The Oklahoma Surgery Center, there's been story after story about it where they post prices like a menu online so you can look and see if you can get a better price.
Is that something that we would see more of under this, where you're going to have maybe different locations, different places within the state that would be competing with each other?
Absolutely, or even out of state. I mean, with health savings accounts, there's already incentive to shop around because if it's within where your deductible is or where it is, if you go and save money, it actually benefits you. The back end of my bill creates incentives within taxpayer-bought health insurance plans where the insurance company will send you a check. So if you can get a procedure done for $2,500 less, in Dallas, and you're willing to fly there, you're going to get half of those savings back. And I think this is a good way to get the consumer re-engaged. The best example of how I know this works, and we can go over some of the numbers, but if you look at all procedures over time, they continue to go up and up and up, and they go up exponentially more than CPI. So medical inflation is 2 to 5 times CPI. However, if you take a look at plastic surgery and LASIK, where people pay out of their pocket, where they actually need to know what things cost, that has stayed flat or gone down because there's pressure to have price competition.
Right. Visiting with State Representative Dustin Burrows here on the Chad Hasty Show, talking about HB 307, which would, I guess, require the posting of prices for medical services, most medical services, not all, like you brought up. There are some treatments where you just can't do that. But where would these be put in an ideal world? Does your bill call for it to be posted online, at the office, both places? Well, where does this? Where do these prices have to be listed? Do we still have Representative Burrows?
Oh, yes,
okay,
sorry.
There we go.
So ideally, we're working on a committee substitute that says, look, if you post them online, you don't actually have to tell somebody, firsthand personally how things cost. So that way they can actually get the information available online or through a telephone number if they don't have internet access. So they have a place they can go easily findable to look up these procedures.
What is what's the process going to be? Have you had any momentum behind this from other lawmakers? I know y'all are always trying to get other people on board, so that way you can build some momentum behind this. I mean, obviously, healthcare is a big national topic. What about in Austin? I mean, what are we seeing down there?
Well, look, a couple things. I've talked to a lot of other legislators about this. I think it's a very good idea. They want to wait and see what the committee substitute looks like as we continue to refine what this bill does. It's obviously a very big lift. My hope is at the federal level, they go ahead and decide this is a state responsibility. In Texas, we would welcome that responsibility to come up with our own plan. And if Massachusetts wants to have universal health care coverage like Romney Care, they can do that. If Texas wants to rely upon the market to drive down costs, let us do that. Let the states actually have that responsibility. We welcome it. So my hope is we see something big happen, a full repeal out of the feds, and everyone says, let's get back to where we were in 2007, coming up with some really good ideas, market-based ideas, to make this affordable for people, because right now it's not.
For your plan to work, does there need to be a full repeal on the national level? How do the two work together?
Actually, there really does not have to be a full repeal. But as far as political will, sometimes I think the legislature needs a gun to its head to actually, get something done. And I think a full repeal would help this process move along. Mine is not, my bill is dealing with healthcare costs and healthcare price transparency. I think even if we see a repeal and replace or even nothing coming out of the feds, this is still really good policy, and it'll help our individuals save money, our county and municipalities and school boards and taxing entities save money, and then, of course, our businesses save money so they can hire more people and offer better benefits.
Visiting with State Representative Dustin Burrows. Moving on to some other topics, other things happening down in Austin. Obviously, the bathroom bill gets huge headlines everywhere. What are some, besides the bathroom bill, because I think it's dead in the House, it's probably not even going to come up, but there are other issues. There are many other legislative issues going on. So what's the latest happening in the House, and what are some of the big issues you are focusing on this week?
Yeah, so I think we're continuing to talk through CPS. The House passed two really good CPS reform bills. This is all that we need to do. We're going to discuss parental rights within that conversation to make sure that, CPS, in the instances where they get it wrong, that we tighten up the law to protect our parents. And so we're going to see that debate come. Obviously, property taxes around the state is a big issue. People are struggling to pay them, and so you're looking at some of the property tax reform issues. Second Amendment, my license to carry fee bill, Chad, has, continues to get co-authors, more and more of them, and so we're continuing to see a real effort to repeal the license to carry fee.
Very good. Let's see real quickly on school finance. This looks like it's going to be a big battle, not only with vouchers, which one of your colleagues said was a dead issue in the House, but exactly how to fund schools or how much to fund schools. This is going to be a big issue in this session, isn't it?
Yeah, you saw HB 21 filed by Dan Huberty the other day. I think Huberty has some good components of his bill. There's a couple of my school districts that get hurt under this plan, mineral wealthy, acetar receiving schools, and so I continue to make the case for them that if we're going to do this, we need to make sure that some of the rural Texas interests, especially the more mineral wealthy districts, are better taken care of in this formula. So we're going to have the debate. We're going to have the discussion. I applaud Dan Huberty for his efforts and what he's done thus far, but we've always got to remember some of the smaller schools out here in West Texas in this conversation. Absolutely.
State Representative Dustin Burrows, we'll let you get on with your day down in Austin, and we'll visit again soon.
Chad, appreciate it again. Thank you very much.
Thank you. That's State Representative Dustin Burrows here on the Chad Hasty Show.